Hi, my name is Valentina Armato. This is going to be my patient Andrew, and today we're going to be measuring lumbar rotation, active range of motion. So for this, I'm going to have him sit to where he's not leaning against the back of the chair so he can get that full range of motion. All right, so to measure this, I'm going to be using my goniometer, and I'm going to place the fulcrum right over the center of his cranium. And then the stationary arm is going to be in line with that imaginary line that connects his two iliac crests. So to find this, I'm going to palpate the acromion, and I'm going to use that as my landmark. Then I'm going to have him rotate towards the right side. And then my moving arm is going to be in line with that acromion process. So for this, he reached about 42 degrees. And you can rotate back. So now I'm going to be testing bilaterally. So it's going to be the same exact alignments. And I'm just going to have him twist towards the left side. All right, twist. All right. So for this one, he reached about 38 degrees. And so this was within the average range of motion for this, which would be 0 to 45 degrees. All right, so for this, I'm going to be doing PA glide for sacral counternutation, passive accessory range of motion. So I'm going to have the patient lay in a prone position with his arms to his side. And I'm going to be standing on the asymptomatic side of the patient. So my right hand is going to go right on that SI joint, so right over here. And then my other hand is going to be going right below sacral level. My hand's kind of facing downwards. I'm going to be applying opposite pressure, like that. And I'm going to be assessing for any type of pain, and we'll also be assessing the end feel. So now I'm going to be testing bilaterally. So I had him flip the other way. He's going to be laying in the same position, and it's going to be the same alignments for my hand. So I'm putting my right hand on the SI joint of the iliac crest with my opposite hand right below sacral level, and I will also be applying opposite pressure. And again, I will be assessing for any type of pain, and I will also assess the end feel. Okay, so now I'm going to be doing grade 5 manual muscle test for hip internal rotation. So for this, I'm going to have the patient sit at the end of a bed or a table with his legs at 90 degrees, and his feet aren't quite going to be touching the floor so he can get that maximum motion. Okay, so to start, I'm going to be putting one hand around his knee, another hand by his ankle, and it's important when doing this motion to look at the motion of the femur rather than the legs. So I'm going to rotate it, do inward rotation. For grade 5, I will be applying maximum pressure or maximum resistance. All right, I'm going to see if he's going to be able to hold that. Now he can go back. And now I'm going to be testing bilaterally and do the same exact thing on the opposite side. All right. Okay. So I'm going to have him rotate outwards while I apply maximum resistance. See if he can hold that position. All right, and it looks like he did good for this. All right, so now I'm going to be doing the passive lumbar extension test. So I'm going to have my patient lay down on his stomach with his arms to his sides, with his legs hanging off the bed. So for this, I'm going to go up behind his legs. I'm going to pull it upwards about 30 centimeters. So I'm just going to pull him up. I'm going to hold it there for a little bit and bring it back down. And then I'm going to be assessing for any type of pain or heaviness feeling in the lower back region, which could indicate a positive test for lumbar instability. This test has a sensitivity of about 84% and a specificity of 90%. All right, so for this test, I'm going to be doing the posterior shear test. I'm going to have my patient lay flat on his back, and I'm going to start on the asymptomatic side. All right. So I'm going to start off by putting his legs at 90 degrees, and then I'm going to apply adduction. And then with my other hand, I'm going to be placing it right over his sacrum. So right about there. Then I'm going to put his legs back up, and I'm going to apply downwards force on the femur. This is going to create shear tension on his SI joint. And then as I do this, I'm going to be assessing for any type of reproduction of pain. This would indicate a positive test. And for this test, the sensitivity would be 88% with the specificity of 100%. All right, so now I'm going to be doing the same thing, just on the opposite side. So I'm going to be testing bilaterally on the symptomatic side. So I'm going to have the patient put his leg at 90 degrees. Then I'm going to apply adduction. I'm going to place my hand over the sacrum. I'm going to push his leg back up as I apply downward force on that femur. All right. And then again, I'll be assessing for any type of reproduction of pain, which would indicate a positive test. All right, so now I'm going to be palpating the L3 transverse process. So to do this, I'm going to start off with the iliac crest as my bony landmark. So I'm going to find that iliac crest, which is about right here. And then I'm going to work my way medially towards the spine. And this is going to be in line with the L4 transverse process. So now I'm going to move one upwards. Okay, it's going to be about right there. So this is going to be the spinous process of L3. So to find the transverse process, I'm just going to move a little bit distally to find where that point goes outwards. Right, and that's going to be about right over there. And so I can also test the transverse process on the other side of his vertebrae, which is going to be about right over there. All right, so now I'm going to be palpating the gluteus medius. So to do this, I'm just going to have my patient lay down on his stomach. I'm going to start off by finding that iliac crest, which is going to be right about over here. That's going to be the origin of the muscle. I'm going to palpate my fingers moving downwards to the greater trochanter, which is about right here. So again, to palpate, I'm just going to start off right by that iliac crest, which is about right there. And I'm going to move my way downwards towards the greater trochanter. All right, so now I just had my patient rotate so that way I could test bilaterally and test his other side. So again, I'm going to find that iliac crest, and I'm going to palpate downwards towards the greater trochanter. It's going to be right about over there. I'm going to do it one more time. I'm going to palpate downwards towards that greater trochanter. About right over there.